Harrison Ross is at the top of their game, and we strive to give the highest level of care that we would give to Olympic athletes, to patients of all ages and backgrounds. I'm effectively a specialist from the hip down, and in particular I look at the human movement and how do people get from point A to point B, and where in that process does it go wrong. So is it, an underlying bony abnormality or malalignment of their foot or tibia, or is it actually to do with the rotations or abnormal rotations at a hip level? And again, is that as a result of problems with the bones or the pelvis, or is it muscular? So we're able to offer all these different types of assessments to get to the bottom of it. It's not just about looking at somebody's feet, it's about looking at the whole person. So how does whatever condition they have in their foot affect them higher up? People could come in with a foot complaint, but it's actually stemming from a problem with alignment or rotation at a hip level. And likewise, people could come in with a knee problem that they've been having treated, and it's fundamentally due to a problem with their first big toe joint and how that's functioning in the gait cycle. We offer one of the widest ranges of forms of assessments here, particularly in biomechanics, and we are able to then implement that with the state-of-the-art, most evidence-based way of treating patients. So be it offering them mobilization manipulation techniques, interreferral pathways with physiotherapists, being able to offer casted orthotics using the latest materials available, be it use customized insoles that we're able to make whilst the patients here. The actual treatment modalities that are available is quite vast, and therefore we're able to make sure that it's tailored and centered to that individual person's needs based on their occupation, the footwear that they wear, the sport activity that they do, their age, their gender. As a specialist, I'm trained to find fault, and technically one could find fault in everybody because none of us are perfect. But children come to us because they have growing pains or they're not performing well in sports. Likewise, we have athletes who are at the top of their game who are wanting to improve their performance or overcome an injury. But, we have a lot of patients in between that who are just, could be solicitors or doctors or people who work in an office who actually have pains based on the positions that they adopt, be it postural or muscle related.